Robbins, and I do wear a couple of different hats. So I am a mental health therapist by trade, and I own a private practice in St. Paul and White Bear Lake called Wild Tree Psychotherapy. So I spend a big chunk of my time working with individuals, couples, and families. I specialize in trauma as well as perinatal mood and anxiety disorders, which is why I also wear a hat as I'm currently serving as the Executive Director of Pregnancy and Postpartum Support Minnesota, which you'll hear about here. We're a nonprofit organization based here in the Twin Cities, but serve across the state. So Sarah asked me to come and speak, and sort of my wheelhouse is mental health during the perinatal period. That's what I'm going to chat with you guys today about. I do have some slides, so I'm going to share my screen here. But feel free to pop questions in the chat, like Sarah said. I was telling her, because I work in the mental health arena, we're always sort of cognizant of confidentiality. So most definitely, if there's questions or comments that you want to make outside of the recording, like she said, we'll end the recording and I'll reserve a few minutes after that to respond to any questions or comments if you don't want to be a part of the recording here. So let me show my screen here. All right. Okay, so let me know if for any reason you can't see it. But today we're going to talk about challenging the myths of parenthood. And I think, you know, in our day and age where, especially given COVID, most everything or the majority of things that you're interacting with right now are virtual. And that includes social media. And what do parents that, you know, are up in the middle of the night for potentially hours on end with a little baby do? They're often kind of like scrolling on Facebook, on Instagram, on TikTok, those sorts of things. And that can really set us up for some struggles, because parenthood isn't all rainbows and butterflies. So we're going to talk a little bit about kind of like the emotional health elements that come into play during pregnancy and the postpartum time. Pregnancy and Postpartum Support Minnesota, which is the organization that I volunteer with. Like I said, I'm currently acting as the executive director, serving our board of directors. We're all volunteers. So that means that we, some of us are mental health therapists, some of us are prescribers, some are concerned community members, moms or parents who have experienced their own perinatal mood or anxiety disorder and just have a passion and a heart for wanting to give back and be engaged in our community. We have a doula on our board of directors currently. So it's kind of a variety of folks who volunteer their time, efforts, and energy to support our organization. But PPSM, which you'll hear me refer to, so Pregnancy and Postpartum Support Minnesota, we are essentially the voice for emotional or mental health during the perinatal time. We work with parents, partners, concerned loved ones, community members, providers to get them connected to emotional health resources and mental health informed resources to serve folks who are in the perinatal period. So what that means is that we maintain helpline so people can call in, and that's not just people who are struggling, but folks who are concerned about parents who might be struggling, providers who are looking for a referral for a client or patient they're working with. But we maintain a vetted list of providers that are well informed of the unique elements of mental health during pregnancy and postpartum. So that's mental health therapists, prescribers, that might be doulas, midwives, OBs, occupational therapists, acupuncturists, massage therapists, the variety of providers that someone might interact with during pregnancy or in the postpartum time. Like I said, we're 100% volunteer run. And we're always looking for more volunteers. So if this is something that is near and dear to your heart, please don't hesitate to reach out and connect with us to help support our nonprofit organization. We run on kind of the basis of 4 pillars. So support, advocacy, awareness, and training. So we're providing support in the community to new and struggling parents, advocacy on the legislative level, awareness just in the general community to talk about postpartum depression, postpartum anxiety, how that shows up, when that shows up, to make sure that we're really catching parents who might be feeling some of this. And then certainly training. And sometimes that's community-based training, and most definitely training with providers in Minnesota so that we know that the folks that we are sending parents and families to are really well equipped to serve those families. So when we think about moving into parenthood, and it's not just, you know, the first time that you bring a baby into your family, and it's not just bringing a baby into your family via, you know, biological means or birthing, but it could be adoption. But we have like sometimes these visions in our head of what that looks like. And unfortunately, I think people forget to tell us about like the hard parts. They sort of paint the picture really beautifully. And whether that's because, you know, when you're a parent and you go through it, you sort of forget the bad stuff once you move out of it because you're like, woo, let's be done with that. Or because you want to sort of save a new parent from thinking about all of the hard stuff. We just sort of neglect to talk to parents about the realities that while it might be great and beautiful and lovely, it might also be really hard and just really suck and not fun at all. And the problem is that when we set parents up believing that it's supposed to be blissful, when their experience doesn't line up with that, then there's these questions of, is there something wrong with me? Am I a bad parent? Why am I not feeling this thing that, you know, that Instagram paints of this beautiful connected relationship between parent and baby? So some of the things that I think we're told when we're moving into parenthood and even adding children to our family is that like it's going to be the most joyful, happiest, fulfilling time of your life, that you'll instantly bond with your baby. You know, we hear about parents saying like, we're so in love when they announce that they've birthed their baby or brought their baby into the family. But you don't hear about the parents that are like, like I came home with this baby and I have to like take care of it. And what? I don't even know this kid. Because that's not what like pretty on Instagram, right? That becoming a parent and mothering or fathering just comes naturally. That good parents are serene and love their children all the time. And they just think that parenthood is the most wonderful thing. That other parents seem to be enjoying this and happy, and why not me? That a good parent should be able to handle it all. That, you know, a good mom should be able to work like she doesn't have kids and parent like she doesn't have a job and balance all these things and without breaking a sweat. You know, other myths that we're confronted with are like that having a baby are going to bring me and my partner closer together, that we're going to bond over this parenting experience, that, you know, if I just nurse, I'll drop the baby weight, or if I don't nurse, I'll just drop the baby weight, no problem. That I'm not going to repeat the mistakes that my parents made. I'm going to do better. That there's a certain right way to do things. There's a certain right choices to make. If any of you have heard of kind of what we call like the mommy wars, where it's like formula versus breast milk, like people make arguments about any of those, like, oh, this one's right, this one's wrong. And that really kind of pigeonholes us into a place of potentially feeling really horrible about the decisions that we need to make for our own well-being or for our kids' own well-being. And it's not just about physical health, but emotionally, what's going to reduce my stress so I can be the parent that I want to be. Or this question about like, you know, staying home and being a stay-at-home parent is the right thing, or working and putting your children in childcare is the right thing. So all of these myths to say that they set us up to fail. They set us up to struggle, because if we're being fed this information, whether it's from our own families or what we're picking up from social media or just generally in our culture, we're not knowing the realities of what we're stepping into as we move into parenthood. It can really land us in a dark place. And struggling alone is one of the hardest things, especially for a parent that's trying to figure out just how to parent and how to keep a little baby alive. They send you home from the hospital, or if you birth in a birth center or at home, like eventually those care providers leave, and then what? Then you're tasked with keeping this little one alive. So we're going to talk a little bit about the common mental health diagnoses or disorders that show up in the perinatal period. And you're going to hear me refer to PMADS, which is an acronym for perinatal mood and anxiety disorder. And the reason that we use the term PMADS instead of postpartum depression, which historically you might have heard of anything that's occurring for a new parent postpartum. And just to preface this, I say new parent, meaning someone who has just brought a baby into their life, not a first-time parent, but they've just added a child, first, second, third, fourth, fifth into their family. So historically, we used to use sort of a umbrella term of postpartum depression, but the reality is it's not just depression that shows up, and it's also not just kind of that classic picture of depression that maybe you've heard of before. So when we're referring to PMADS, we're talking about the spectrum of mental health challenges that a new parent might be experiencing during pregnancy or during postpartum. It's actually quite common for depression and anxiety symptoms to show up during pregnancy. And if we can catch it during pregnancy, we have a better chance of kind of getting a handle on it, so that when that baby is on the outside, that it feels a little bit more manageable. So probably the most common thing you've heard about is postpartum depression. And up to 20% of parents experience postpartum depression. So that's that kind of like diagnosable major depressive episode or period where there might be experiences of sadness, feeling down, feeling lonely, feeling isolated, feeling overwhelmed. There might be sort of feeling lots of tears. And know too that anytime that we're dealing with kind of fluctuations or increases or significant decreases in hormones, that it can make us more tearful. You might just notice that just being pregnant or postpartum. And that's our body responding to hormones. So about 80% of parents experience what we call the baby blues. And that is that about 10 to 14 day period after baby is born, when hormones are kind of like all over the place. We have a big hormone crash when baby exits the body. And a parent can describe feeling sort of not themselves, off kilter, really tearful, really big emotions. If it's just the baby blues, it will level off on its own within 2 weeks. Now, when we're looking at postpartum depression, it's something that persists quite a bit longer than those 2 weeks. And the reality is, if it's not treated, it can last for years. So generally, when you hear someone talk about the postpartum period, we're talking about the first year after baby's born. But if it goes untreated, it can persist much longer than that. The unique thing about postpartum depression is it's not just that specific picture of postpartum, but there can be rage episodes. And that's actually something that's quite commonly reported by moms. But there's a lot of shame that parents feel about, like, oh, I just had an anger outburst, or I just wanted to, like, I understand why people, like, shake their baby, right? Not that this person is going to do it, but there's so much intensity and emotion. And it's really important to talk about that, because that is a symptom of postpartum depression that's not as widely known. There might be kind of the social withdrawal piece, or feeling detached or disconnected from baby. There might be changes in appetite, so eating more than what would be typical for that person, or far less. There might be a disruption in sleep. Of course, we know that when we have a newborn or even a toddler, as a parent, we're not sleeping super well, but this would be above and beyond. So when baby's sleeping, having a harder time getting to sleep yourself, difficulty concentrating, it might just be this general feeling of like, I don't feel like myself. And the reality is, especially when you become a first-time parent, you're not yourself anymore. Something has completely changed and turned your life upside down. And there's some grief and loss that can come with that, this sort of like mourning of your pre-child life and what it was like. But that there is this entire shift that happens. It's a life stage that happens when we move into parenthood. So it's normal to have a period of adjustment, but what we're looking at is emotional challenges that span beyond sort of typical adjustment for you as an individual, and that cause problems in your day-to-day living, whether it's taking care of yourself, attending to other children's needs, being able to engage in your relationship with your partner, getting to work. Sometimes this can show up when parents are transitioning from a maternity or paternity leave to back to work and having to balance and juggle that. In dads, we'll talk about this a little bit more later on, but depression in dads or partners can show up a little bit different in men. It can tend to look a little bit more anger outbursts, might be avoidant patterns. So there might be increased substance use. There might be avoiding coming home. So overworking could also be the opposite of like completely retracting from engaging socially and sort of under engaging, sort of irritability and on edge. So just things to notice in yourself or in your partner. Like I said, it's not just postpartum depression though. Postpartum anxiety shows up in about 1 in 7. I will say from my practice as a therapist, I probably see more anxiety, postpartum anxiety or perinatal anxiety than depression. As a culture, we have things in our society that foster experiences of anxiety in general. And so then to add on the layer of being pregnant and postpartum and managing that transition, anxiety rears its ugly head. So certainly it can be this experience of intense anxiety, sort of spiraling or swirling thoughts, feeling consumed by those thoughts potentially, that agitation, irritability, that's a pretty common experience. I think just in general as a parent, so I didn't mention, I'm a parent of 4 children. I have a 7-year-old, a 6-year-old, a 4-year-old, and a 1-year-old. So I'm right there with you guys. But that there can be just like this sensory overwhelm, like way too much input, auditory input, like feeling overtouched, that sort of thing. And then the result of this like agitation or irritability. Again, the trouble sleeping as well. Like if you're finding yourself sitting and watching the monitor instead of sleeping when you are like dog tired, then that might be a sign of like your brain not being able to kind of slow down when it needs to in order to get the rest it really needs in order to heal and recuperate. An anxiety disorder, this is obsessive compulsive disorder, which shows up at about 3 to 11% of postpartum folks. And what's often noticed with that is these intrusive thoughts. So not thoughts that someone goes out like looking for, but they kind of like bombard you. And they're often thoughts about the safety of your baby. You might find yourself like not wanting to walk down the stairs while holding the baby because you're having these kind of like bombarding images of falling down the stairs or throwing your baby over the balcony or dropping your baby underwater in the tub. They're really thoughts that can be quite jarring and scary. And just know that it's relatively common, and please do talk to your OB or your child's pediatrician about it so that you can get connected, because you don't have to live with those feelings, and know that you are not going crazy. Understand that having these thoughts and being distressed by these thoughts means that you're not going to act on them. Just because you had a thought, it doesn't mean you're going to take action. But it does mean that you deserve to have the help and support available to you to reduce that, because it's not a comfortable experience. Postpartum psychosis is a real thing, and it's a real medical emergency. Now, it only shows up in about 1 to 2 in 1,000 birthing parents. So not real common, but it is a serious concern that when someone is in a state of psychosis, they're losing touch with reality. So their thoughts appear to them from their perspective as rational, but if you were an outsider listening to their ideas and thoughts, they'd sound really illogical. And in that, it can wax and wane, so it can come and go. And if you have a friend or a family member you notice is experiencing that, or maybe you even suspect something's going on with yourself, that is definitely a reason to seek medical care. And then birth trauma, which I told you guys, I am a trauma therapist. And so this is something that I see quite often in my office. About 3 to 15%. There are statistics that show up to 40% of birthing parents and families. So it's not just restricted to the birthing parent, but it could be the partner who witnessed something during the birth experience or pregnancy experience that caused traumatization. So upwards of up to 40% report a traumatic experience associated with their pregnancy or birth or postpartum, which could be breastfeeding experiences and challenges and struggles. So things that lead to trauma, or if you're thinking about was my experience of having my baby, was that traumatizing to me? You might notice things like kind of having some obsessive thoughts, or sort of reworking the story, going over and over and over again, trying to figure out where something went wrong, or why this intervention happened. So common things that can lead to postpartum post-traumatic stress disorder would be medical interventions that weren't planned for or wanted, potential complications, having separation from baby right after baby's born for a period of time, a NICU stay or experience, any sort of loss. So that could be an early miscarriage all the way through stillbirth. The reality is that the impact of the loss has to do with the attachment that you had to the baby, not the gestation. So it could have been a 5 or 6 week long pregnancy, but you had already connected with that experience. And so the impact of that loss is going to be felt in that way. So like I mentioned with the baby blues, that sort of up to 2 week period, which I'm guessing most of you are out of, although if you have another baby to be aware of, up to 80% can experience the baby blues depressive symptoms, but they self-resolve. However, we know that about 70% of postpartum moms will experience depressive symptoms. Now, that doesn't mean that it's a major depressive disorder episode. So it doesn't mean that they're going to qualify for postpartum depression. And please know that you don't need to meet the diagnostic criteria of some mental health concern in order to seek care and support. You deserve that care and support no matter what. About 22 to 25% will experience anxiety symptoms. Like I said, anecdotally, I think that's higher. Just think about yourself and your own experience, or any friends or family members you know, and what they experienced. And then we also know that birthing folks who have a history of bipolar disorder, they have a fairly high likelihood of having a relapse during pregnancy or postpartum. And when we're thinking about medications, just know that there are acceptable medications to be taking when you're pregnant, if you're breastfeeding. Please know that you do not need to get off medications. From an emotional health standpoint, we think about a healthy mom is a healthy baby. So the amount of sort of risk level or transmission of medication through breast milk or through the blood-brain barrier with the placenta is relatively low compared to an unwell parent. So we want to make sure that you're doing okay. And like I mentioned, it's not just limited to women or to birthing folks, but we know that 1 in 10 partners, so 10% of dads, will experience postpartum depression or anxiety. So we want to be aware of our partners too and checking in with how they're doing. Typically in a partner, it's going to show up later in the postpartum period. So it won't be kind of that initial time. Like if you are a birthing parent, it's usually within about the first month that stuff starts showing up. For partners, it could be months out from that. If there is a partner whose birthing person has a postpartum mood or anxiety disorder, they have about a 50% chance of developing one themselves. The key hormonal shifts elements, so like I said, right after birth, there's a big change in hormones. If there's a point where someone stops nursing or breastfeeding, there's another shift in hormones. When their menstruation returns, there's shifts in hormones. So particularly if you're somebody who you know that maybe you've had PMS symptoms in the past or struggled with the fluctuations in your cycle and know that maybe you get irritable or tearful or on edge, that is something to sort of just be aware of, that when things shift hormonally in response to having had a baby, that it's a risk factor. Other risk factors that we just want to be aware of. So maybe in your mind right now, if this is something that you've logged in to watch because you're curious about it, or you're concerned for yourself or someone else you know, think about this as a checklist. Are there things that sort of set you up to have a propensity towards this? And all this is doing is just knowing, okay, so I need to just take really good care of myself if I have some of these risk factors, so that I can be well. So if there's any family history or personal history of mental illness, so if you have any history of depression, of anxiety, of obsessive compulsive disorder, of suicidal ideation, or any close family members, blood family members, something to be aware of. If there's any high risk in your pregnancy or postpartum complications, like I mentioned, kind of a traumatic birth experience. And remember that trauma is in the eye of the beholder. So it's not about anyone else naming your birth experience as traumatic. It's about you identifying if something about your birthing experience or your postpartum experience feels bothersome, or you kind of feel stuck on it, then that may well be trauma for you. Having a baby who is in the NICU, I'm going to add in here, in the time of COVID, having, well, not just babies born during the time of COVID, but like children in general, and not having a break, not having potentially access to childcare in the way that you might be used to. So just not having breathing room. A lack of social support or social network, so really feeling that social isolation. Any sort of conflict or not feeling connected or supported by your partner if you have one. Any history of a pregnancy loss or stillbirth. The other thing to be mindful of, if you are someone who had a cesarean section or know somebody who had a C-section, about 32% of moms experience postpartum mental health challenges. So that's in part because of the complications of like added stressors related to initiating breastfeeding. There might be a delay in milk coming in. There might be just a different experience as far as how your baby came into the world and how you understand that or make sense of that experience. And in general, like I said, those medical complications or unexpected interventions can set you up to experience birth trauma. So the biggest thing, one of the biggest protective factors is support. So finding your group of people, and that might be support from your partner or a parent or, a mother-in-law or father-in-law or a sibling or a best friend or a fellow parent. It might be doing things like this, like showing up to an ECFE class where you can engage with other people who are at the same place in life. Finding support groups. Now, a lot of them are all virtual, which I know you guys, I'm doing all of my sessions virtually right now. Like, it's not always the best. We need human contact and human connection. So this is a really hard time. The last 9 months has been a really hard time for a lot of parents, especially if you're juggling having older kids who are in school and distance learning, or just all of the transition. It's like tenfold for a parent with a young kiddo right now. But reaching out and connecting in support groups. So whether that's like a parent support group or like a support group for yourself, mental health wise. We, PPSM, we do have two options for support available to you. So one is we have a Facebook closed group, which is only available to parents who live in the state of Minnesota. So it's a private group on Facebook where people post resources and ask questions and provide support to one another on the page. Additionally, we have a Thursday evening live virtual support group that's facilitated by our peer support volunteers. And so those are parents who have been through this. They have struggled with postpartum anxiety or depression or obsessive compulsive disorder or psychosis. They've been through it and they're at least 1 year out in their recovery experience and want to support other parents who might be struggling. So that's available to you, both of them obviously free of charge. The one on Thursday nights is from 7 to 8 p.m. Every Thursday. And you just sign up just like you did today to sign up to get on here. Another element to be thinking about is how are you balancing things? So when we move into being a parent and being responsible for this little being, this little life, and like meeting all of their needs, sometimes we forget to meet our own needs. And I'm here to tell you that self-care is not selfish. Self-care is essential. Going back to the idea of like a well parent equals a well baby or a well child, sacrificing yourself to meet others' needs ultimately is going to lead to your deterioration and also reduce your capability to provide the care that you want to your kiddos, to your partner, potentially, to your friends. You'll start to feel depleted. When I think about sort of the 3 pillars of wellness, so if you were to assess your own sort of like, how am I doing? Ask yourself, how am I sleeping? What am I putting in my body? So like food, water, that sort of thing. Is it giving me energy? And how am I moving my body? So am I taking care of my body, like stretching or moving it in a way that feels good, going for a walk? I'm not talking rigorous exercise. I'm just talking about noticing how your body's feeling. So a couple of ideas of self-care, and I know self-care is kind of like a catchphrase right now, but it truly is essential. So asking for help when you need it, getting time away and alone. Like I said, now is a really hard time to get that time away because our access to childcare options might be really limited, but figuring out a way that you can have some breathing room from being in that parenting role. Prioritizing yourself, asking others for what you need. That might be, I need you to do this for me. I need you to check in on me. I need you to find time to hang out with me. It might be setting boundaries. So like saying no to things that you really don't want to do instead of feeling obligated. It might be staying at home right now. It also might be going for a drive outside of your home. And most definitely forgiving yourself. So when you show up as a parent that you don't necessarily want to be, that forgiving yourself because it's hard and we're doing the best that we can. So again, I'm from Pregnancy and Postpartum Support Minnesota. A couple of the options available to you if you're looking for extra help, either for yourself or someone you care about. We have our helpline, which is a warm line. You can text, call, email in. We'll get back to you within 24 hours. We can get you connected to a provider, a med provider, a therapist. We can get you connected to our peer support volunteers that I mentioned. They offer both one-to-one support. So if you want somebody to kind of be texting with you and checking in on you or talking to them on the phone. And then we also have that Thursday night virtual support group. If you hop on our website at ppsupportmn.org, there's a whole host of resources for multiples, for C-section parents, for challenges around mental health for LGBTQ families, just a variety of connectors. So that's our role in the community. We connect you to those people, places, and programs that support your emotional wellness during your parenting journey. And just know that, like I said, I'm a mom as well to 4 little kids. I'm working from home at this moment. Throughout this presentation, you may have heard them running around outside my door. That we're all in this together right now, and you're not alone. This is me. Feel free to reach out. Like I said, I'm serving as the executive director of PPSM right now. I'm a mental health provider as well. And you can connect with PPSM on sort of all your general social media. You can follow us. You can get resources from us. There's that closed support group as well. So I'm just going to check here and see.
Wonderful. Thank you, Lauren.
Yeah.
I don't see any questions on my end of the chat box, but
I don't either. Yeah.
Does anyone have any questions for the large group? Otherwise, I can certainly stop the recording and we can see if anyone has any more personal questions to ask. But I personally just want to say thank you, Lauren, for speaking. I know this is a topic that I think a lot of parents that we've talked to here at Centennial ECFE just have a lot of questions and concerns about and aren't always sure where to get connected. And so I appreciate you sharing those resources and just normalizing the fact that this is something that a lot of parents struggle with, both moms and dads, and just caregivers in general. And I think it's very much more common than I think we realize. So thank you for breaking that down for us and helping us understand that a bit more and opening up that discussion. So
of course. Yeah. I mean, that's part of what my job is, to just like start talking about it, break that stigma around mental health in general, but most definitely mental health concerns during the pregnancy and postpartum time, because people tell us it's all wonderful and magical, and it's not always what it's cracked up to be. Right.
Wonderful. Well, thank you. Unless there's any other questions, what I'll do is I'll stop the recording at this point, and then we can stay on for a few more minutes if there are any more questions from the audience. But thank you again, Lauren, for joining us. I'm just going to stop the recording here.